like to introduce yourself?
Sure. My name's Steve Pacheco. I'm the CEO at SigmaCare. We're a technology provider to the long-term post-acute care industry. So our customers are skilled nursing homes, assisted living, home health, that part of the healthcare industry. And we are looking to deliver a pretty comprehensive technology platform. So it's electronic medical records, financial management, CRM, really broad platform into that healthcare segment.
And my name is Bruno Skap. I'm the co-founder and host of Business and Technology of Greater New York. Steve, what are the most important decisions you make as a leader of your organization?
And I think, when just a little bit of context with SigmaCare to give you a perspective where I'm coming from. We had no revenue, about 10 employees 10 years ago, and we kind of grew the business. So I kind of think of SigmaCare as 3 different companies over the last 10 years. And I think that's one of the themes that really changes as you go through these as you grow. Right, the business really changes. So, but what's been consistent, I think, is as far as the decisions are resource trade-off decisions. So, it's healthcare and it's technology. There's a lot you can do. We're in a market that's changing dramatically right now. So we're not lacking for opportunities. So it's, do you go left or do you go right? Do you pick A or do you pick B? And you can't do both, right? We're still kind of considered a growth company, growth equity, backed by a private equity company. So so I think it's the trade-offs between what seems like really attractive strategic opportunities to you. Do you pick A or do you pick B? Because you can't do both. And then I think, honestly, it's people decisions. It's people and leadership decisions are the hardest decisions, and it's your head and your heart kind of going, colliding together to try and, are you doing the right things? Because in a technology business, at least ours, to reduce it to numbers, 80% of our costs are people, or people-related costs. So when we're thinking about allocating resources, it's all about people and leadership. So making those decisions about the team and the leaders and making the right trade-offs or what wakes me up at 3:13 in the morning.
And what is more important to you, your company's culture or strategy, and why?
Yeah, I think, Peter Drucker, for those folks who know Peter Drucker, kind of famously said that culture eats strategy for breakfast, right? He's shaking his head. And, having been, I worked at Pfizer for about 12 years through a period of, rapid growth. They went from $25 billion market cap to $200 billion, all organic. There was no acquisitions at the time, and I've been in small companies now. And I really do think it's all about culture. I think, by definition, strategies and even technology are time-bound, right? So the strategy is dependent on where you are today, what's going on in the market today. I think culture transcends it, transcends time. I think it's on the par with the mission and the vision of the business. Like those 3 things to me are the pillars of your business: is your mission, your vision, and the culture. And again, those things transcend time and enable, I think, enduring success for the business. I would add close after that, capital. So it's culture and capital, especially as a startup company, having the right capital partner in your business, I think, is critical because if you're not aligned and if they don't have the right time horizon and patience or aggressiveness, you're going to be out of luck. So I kind of come to view this issue about strategy and technology versus culture as inputs and outputs, right? So the outputs to your business are, growth, equity value, good technology, strategies. Those are the outputs. What are the inputs that are going to lead to consistently good outputs? And I think it's culture and capital. Those are the things that are going to lead to consistently good outputs for the business. So that's kind of why I think culture can overcome a lot of technology issues and a lot of strategy issues, or will lead to good strategy and good technology.
Yeah, definitely. And how do you and other leaders in your organization communicate the culture and core values, mission?
Yeah, I think what we believe is culture. If you have a strong culture, the thing that it allows you to do is have less rules in the business, right? If you have a really strong culture, you need I hate policies and rules, and it feels like it gets in the way. And if people are acting in the best interests of the company, you can worry less about those things like policies, right? So
Right, like the governance.
yeah, the governance. Just treat people with respect, give them a vision, create a place where they care, and a lot of good things I think come out of that. So my thing is, if you have a strong culture in the business, you need a whole lot less rules in the business, less policies, all that stuff. So I think one of the things that we did well to communicate the culture, when we were 10 employees and no revenue, we set out and said, here's the mission and the vision. And then we didn't call it culture at the time, but we established what the values were for the business. And then we really mapped behaviors to those values. And then I think we did a great job of tying performance to the values and the behaviors. So we would sit down and have performance reviews with people, and it was partly about what you accomplished, but a lot about how you accomplished it, right? So, and that's where I think kind of you can perform well in the short term if those behaviors, those leadership behaviors aren't in place, but the long-term success isn't going to be there. I don't know if people are baseball fans or not, but I kind of use the example that you may be up in the 9th inning and it's 2nd and 3rd, and a pitcher throws a fastball in on your hands, and you just get the bat out, and you hit this bloop single into short left field, 2 runs come in, and you win, right? You're down by a run, and the 2 runs come in by you win, and that's great, right? And it's nothing better than winning. But if you can't handle the inside fastball consistently, you're not gonna perform long term. They're gonna figure it out, and that weakness is gonna manifest itself in subpar performance long term, right? So that's how I kind of look at values and behaviors and culture. Those are the leading indicators. Those are the inputs to long term, consistently successful performance. And so I think we did a nice job of saying, this is what we value as a business. These are these concepts, and it's things like, energize the organization and being customer focused and having courage. It's the inputs, and we would assess people on that, and it became part of how we communicated, right? It became part of the DNA of the business. And then you got to talk to it and live it, and we talk about it at company meetings and all that. But we're at a point now where we've grown. We've done 2 acquisitions, and so we're trying to incorporate different businesses. So we're stepping back and we're creating this culture manifesto now, and we're really trying to define longer term what we think the culture needs to be, and again reassessing the values and some of the behaviors. And I think culture is not just about values; it kind of goes beyond that. But anyway, so those are some of the things I think we've done. We've really tried to operationalize. I was at Pfizer. I tell this story a lot. Sorry for kind of being old, but they went, when I was at Pfizer, they had no mission, vision, or values, right? And they went through this process and focus groups, and Pfizer had more money than God at that time, and they could do anything they wanted. And so they did a worldwide assessment of the mission, vision, and values, and they wrote it on scratch pads. They actually created mobiles, put it in the conference rooms, and did nothing beyond that, right? It never became kind of part of the DNA of the organization. They patted themselves on the back, they put things up in conference rooms, and they felt really good about it, but it never felt real. And so our mantra was, how do we operationalize the mission, vision, and probably more importantly, even importantly, is the values of the business.
Right. What is one characteristic that you believe every leader should possess?
Thought about this issue a lot, and I think it's humility with a close second of vision. All right, so but I think it starts with humility. I think humble people, and I guess one thing is humility doesn't mean you lack confidence. Those are different things. I think humble people learn. Humble people collaborate. Humble people are more willing to collaborate. Humble people don't take anything for granted. Humble people respect everybody in the organization. So I read the book. I don't know if anybody else read the book Good to Great, back in the day, and they talked about this thing called level 5 leaders, and it struck me that the CEOs of the great companies attributed a lot of their success to luck, right? And these were these incredibly impressive, accomplished people, and they said, I got lucky. I got in this market, or I had good people, or whatever it is. And I think objectively, if you looked at it, it wasn't a lot of luck, but they thought it was, and that was the point, right? So I think they thought I got lucky. So if you're this person who thinks I got lucky, our success is based on a lot of luck, you're not going to take anything for granted. You're going to be really interested in what's going on in the market. You're going to be really curious, right? So I think it's, if I had to pick one, if you're humble, you're open to feedback, right? You're willing to grow and learn. So I really think it's humility, but then followed closely with vision. That you have to have a view of where the business is going. And I think I think as a leader, there's 3 things that you need to have a vision around. You need to have, so we're in the long-term care technology business. So I have to have a vision of where the long-term care industry is going, right? Where the providers, what's CMS doing, and where nursing homes and hospitals and the Affordable Care Act, and where is all that going, right? We're in the technology business too. So I have to have a view and a vision of technology. And then there's people. And I've got to have a view and a vision of people, right? And managing and leading and driving engagement with people. So I think humility matched with a vision is kind of what are the most important qualities for leaders.
Someone going into the leadership position for the first time, what advice would you give them?
I think, assuming that leadership means you're managing people, I think the first thing you got to do is get to know your team. All right, when I've taken over kind of roles, and I think the most valuable thing I've done is sit down and meet everybody and talk to them and get to know them. And get to know them, what they're doing today, where they want to go, what they care about, what's important in their lives. So get to know people and stay close to them, stay connected to people, because you're gonna be successful whether dependent on the people on your team, right? So I think that's first thing is get to know the people. I think second, being humble in that role. I think third is have an insatiable appetite for learning. Again, I remember being back at Pfizer, and this guy walked around with this book, And I said, what would have happened if he didn't read that book? Like, he would have no knowledge. It felt like it was all about what he had just read. And then I read the book and I said, wow, I got a lot out of that. And it changed the way I thought about it. I think you have to have an insatiable appetite to learn. I think you got to recognize also that people are whole people, right? They come to work, but they have a life outside of work, and I think you got to respect that and support it. And people go through ups and downs in their lives, and I think you got to support people through those ups and downs as much as you possibly can. And if you do that and you listen, you build respect and trust. And then the last thing I think is communicate. Especially in a small company, I kind of look at communication as octane in the gas. Right? In a small company, people are passionate. And if you communicate well, it's like giving them Sunoco Ultra gasoline, like 94 octane. If you communicate poorly, you're giving them like 83 octane gas, and there's going to be knocks and they're not going to go as efficiently. So I think so that would be the few things I think as a leader going into a new job. I'd want to communicate, get to know the folks, be humble, and learn, and treat them as a whole person.
Great, thank you. What's one of the biggest IT challenges you faced at SigmaCare, and how did you handle it?
I think a couple years ago we took in private equity. We had been kind of backed by strategic angel investors and strategic partners, and they made an investment, and we did an acquisition of a small company. And I remember kind of completing that and thinking I had nothing left to do. Right? We went through all this effort to raise this money and make this small acquisition, and my wife said to me, "Don't worry, you'll figure some new things out." And I think what emerged out of that was changing, evolving how we deliver our technology, which had kind of two components to it. First was we were in kind of a third-tier data center. Right? We're a SaaS, centrally hosted application. We were trying to get the cheapest service we can, and you get what you pay for. So we had to get out of that, and frankly, we didn't have the people on board, so we had to go out and kind of bring some people in and do that. And then I think the other thing that happened, our strategy with delivering software was kind of high touch, being really consultative with our customers, going on site, and the market started to change a lot. And we had to evolve how we did that. And it was a mix of the team kind of innovating, and then I think at one point we made a decision to take two or three people off operational activities and just work on trying to innovate how we deliver software into the market. And it was a tough choice. And I think the thing as you grow, today always trumps tomorrow. Operations tends to trump innovation. And I think as we as a business looked at it, we said we gotta have to do something a little bit different. We took a couple people, put them out, and then we're kind of now identified some opportunities and are giving it back to the operations people to implement. But I think it was really about evolving how we deliver software into a market that has a real wide range of users. So we have doctors down to nurses' aides, and so there's a real broad spectrum of users, how much they use the product, what education levels they're at, how facile they are with technology. So we really had to think about evolving how we deliver technology, because the market was moving, and what the market was willing to pay for the delivery of those services was changing pretty rapidly. So that was probably one of the bigger, I think, challenges we faced along the way.
What strategic IT investments are you making to improve resident and patient experience?
Yeah, I think the resident and patient experience, it starts, the market's changing dramatically. When I first went into long-term care, people said, "Why are you doing that? It's this sleepy little market. Not a lot's going on. Nursing homes won't pay for technology. They won't do it." And we always thought there was a pretty strong technology value proposition. They're they're pretty inefficient businesses. But that was but then the financial crisis happened, right, in 2008, and the Affordable Care Act came out in whatever it was, 2010. And that those two things, those two macroeconomic events changed the post-acute care market forever and dramatically, right? So this thing, post-acute care was about Medicare and Medicaid, and it was fee-for-service. And so, you know, nursing homes and doctors and everybody got paid fee-for-service. So it's changing on two fronts there. It's quality-based reimbursement. So you have to deliver outcomes, and if you don't deliver good outcomes, your reimbursement's going to suffer. You're not going to get paid. And then the other thing that's happening is the government is getting out of the health insurance business. And that might be a surprise to some people, I don't know, but the government was in Medicare and Medicaid. It was fee-for-service. They're outsourcing that to private health insurance companies, Cigna and Aetna and folks like that, and they're coming in and they're doing, managed care does what managed care does. They're coming in and negotiating with providers for, we'll give you more volume, but you need to give us a better price, lower reimbursement. We're creating preferred networks, so they're voting some people off the island and they're keeping some people on the island. They're really getting involved in the delivery of care to the extent that the government never did, right? So what we need to do, so with that context, what we need to do is help the providers deliver better outcomes, lower rehospitalizations, better quality of care. So what we're looking to do is, through our technology, deliver better clinical content and clinical decision support through our technology to help them make better clinical decisions and get better clinical outcomes. So that was a long answer, Bruno, to that. But yeah, it's really all driven by the market. And so what we're trying to do is deliver technology to help them provide better outcomes.
A long answer is okay, by the way. After years of focus on delivering value to the business, why is IT largely still viewed as a cost center?
I think because they sometimes focus on weird things, and maybe weird or non-strategic things. I think technology needs to enable something. It needs to, and I think sometimes it's technology for technology's sake. And so it's not about the users and what the users of that technology are focused on. So I think, sometimes, at least in my experience, they lose track of the users. And so we have this thing, we got to build technology for the users. And so you got to know them well, but I think sometimes they lose track of that technology is not an end, right? It's a means to an end.
Yeah, technology people like to play with technology.
With technology, right? It's technology for technology's sake.
And what would you say is your top 3 business and IT priorities for SigmaCare in 2016?
I think our business priorities are we want to grow through selling by growing value with our existing customers. So we could double our revenue, our recurring revenue, by selling all our software to all our customers, right? So we have customers who are using not our entire software suite, and if we could just get them to use it, we would double our revenue. So we want to grow revenue by selling more to our existing customers. We wouldn't need one new logo one new customer in a way to double our revenue. So that's a big priority. I think expanding the gross margin of our business, the percent gross margin on our recurring revenue, to me that shows that the business scales, right? So our internal operations, customer support, our data center scales as the business grows, and we grow our margin. To me, that shows we're managing the business and we're getting scale out of the business, and then we can invest the growth in gross margin into more technology development, which is kind of the third priority. We've bought these 3 companies, and so we really want to more fully integrate the technology, so it really is one platform. It's not 3 products, it's one platform, and we're promoting it and delivering it into the market.
What are some of the things that you're doing or implementing to improve the effectiveness of IT services you provide to your customers?
I think there's 2 things. We like I said, we bought these 3 companies. We want to make bigger investments in our product development organization. We're not sure how just yet, right? So how do you scale product? How do you scale product development? Can you take advantage of outsourced capabilities? Do you have to do it all internally with your own, hire people? Is it a blended thing? What's success? How are you successful if you're going to outsource some of it? Or the different regions of the world, literally, for where some of our processes are still immature on that. We're not, we're 130 people in the company, right? So we're not a huge organization. So some of our product development processes are still immature. How do you scale our product development organization? So before we invest the dollar, we want to make sure we have a good plan to get the return on that dollar. And so that's a big priority for us this year. And then I think the other thing is more of an internal thing about getting rid of spreadsheets and moving towards an internal CRM tool for us that creates one thing across the organization. So from when our sales folks sell it to our implementation team implements it, and our customer support organization supports it, and our finance team builds it. We've got a lot of different things, and there's a lot of spreadsheets. And I think what that does is it creates friction in the organization. It creates friction in our ability to serve customers. So we're on a mission to kind of reduce friction, and it'll allow us to collaborate, and it'll better as a team, and it'll allow us to serve customers more effectively. So those are the kind of the 2 priorities this year.
Great, thank you. We're gonna open it up to questions.
You know what it is? I don't think it's a challenge to get people to buy into the concept. I'm not sure they fully understand the change that needs to happen to implement it and do it and adopt it effectively, right? So I think I separate those 2 things, right? I think people understand that, wow, this takes so much time, right? We're managing spreadsheets and I got to go get this information. But I've been through kind of a CRM implementation in a prior life. You got to put in a lot of time to make it work, right? And it's an investment up front. And I think we're probably underestimating some of that investment to get it right, right? Because it's a tool that needs to get that customizes is too strong a word, but the workflow for your business, you need to adapt it, to make sure that the workflow in the tool is going to match the workflow. And there's some change to that. So I don't think the concept of this, I think everybody's like, oh my God, give it. They're like insatiable. They've got this hunger for it. Give it to me. But I'm not sure they understand the time it's going to take to become proficient in it, that's more my concern. We've starved them for so long on a tool. They've managed from spreadsheets for so long that I think they're on board. But I'm not sure if the investment is. You know why I say that? Because on one or two groups, not Julie's, I'll say, but in one or two groups, I keep saying when are you going to be able to go live on version 1? And I'm not getting an answer. I'm not getting an answer. I think I think it's I don't think it's either. I think it's, dare I say, capability. I think it's the ability of the people to drive the change in the organization, right? So again, I think people are on board with it, but do they fully understand or have the ability to create? I think leaders, especially in a small company, one of the most important things that they need to do is be proactive change agents. Proactively create permanent change in their organization. And I think sometimes it's more they're not sure what to do to create this change in their team. How do I get my team to adopt this, or how do I get my team to turn and go in a different direction? They've been doing it this way for whatever, right? Fairly successful. Now we got to get them to change, and again, I still think they love the concept of the tool, but is the leader going to be able to get them to change? Yeah, so we were an electronic medical record, right? That was our base business, and then we bought a financial application because our customers want to get clinical and financial from the same vendor, so we bought that. For billing, exactly. For billing, patient accounting. Yeah, exactly. So it takes the clinical information and it creates the bill that gets sent to the payers, and then it's billing and collection type stuff. And then kind of on the front end, we bought a CRM, right? It actually competes against Salesforce, but it's long-term care specific, right? So we're attaching it as the front end of our technology platform. So it's helping, because these businesses, the complexity of them, they had no sales and marketing capability if you go back 5 years ago, none. They would call up the hospital would deliver patients to them, right? Or people would knock on the door. They had no sales and marketing. They're looking to build a sales and marketing capability, right? So we're helping to do that, and we wanted to get tied in. We bought businesses that were on the same technology stack as ours. That was important to us. So we're a Microsoft shop, and we look to centrally hosted Microsoft shop. So we look to buy tech businesses on the same technology stack. And then I think culture, honestly, culture was an important consideration as we look. We walked away from one. A big part of that was a culture fit. We thought that it was a dramatic clash of cultures. I think the change in the last 10 years was more around how the users were adopting the tech, how we were delivering and the users were adopting it. Right? So when we first got into it, they literally would pick up a mouse and like do this against the screen. Like they had now everybody's walking around with mobile devices. But we've been on a pretty, from the software that we're building, we've been on this pretty consistent mission about create workflow software, right? So that's kind of what we've done. Create really robust interoperability with lab, radiology, pharmacy, hospitals, all the constituents that round out the medical record, right? Then we want to focus on analytics, data and analytics. That's kind of the next step. So that's where I think the market's going. And then eventually we want to engage the patient, right? So we want the patient to be involved, and in our market, the patient's family. So we're going to collect all this great clinical and financial information, and we're going to want to eventually publish it and give access to the patient as they leave, the patient's family, right? Check on their mom or their dad in the nursing home, and kind of engage that way. So that's kind of where we want to head. We're kind of on those. We're on the first two steps, or we're largely completed with the workflow software and then beginning to deliver interoperability. We got to get to analytics. I hope I'm not here in a couple years talking about we're trying to catch up on the analytics side. And then I think engaging the patient and the patient's family is where we want to be.